There are huge changes happening in Commonwealth aged care programs, causing other levels of government to reconsider their strategy and their role in response. Victorian local government leaders are debating their future role in this new world, and what comes out of it could provide some insight into the future of aged care at home across the country. Dr. Danny Davis is a visiting fellow at the UTS Institute of Public Policy and Governance and managing director at Link Community and Transport. He joins me now to discuss this curious space. Thank you so much for your time.
Great to be here.
Well, let's dive right into it. And what's going on with local government at the moment? And then we'll get into a bit about aged care and transport as well.
Sure. Well, there's big changes happening in the federal aged care program, and the local governments have been for a long time involved in delivery of that. And as those changes are happening, they're saying, do we still need to be in this? Is this really what we need to do? Are we a delivery agent? Or is that actually the right role for government?
Right.
So they're actually taking a real step back and saying, what is the role for this tier of government? What is our purpose? What do we need to do here? And the thing is, they've got a lot of resources tied up in it because they have money coming through from the federal government into their own coffers. They've got their own budget, they've got staff, they've got structure. So it's quite a big change for them. And a lot of them are really kind of stepping back and thinking, well, you know, what does this mean and what should we be doing?
Okay, so do you think that presents an opportunity, you know, if they are taking a step back to assess and reevaluate, what's the best role for local governments moving forward, do you think, now that they've taken that step back?
Yeah, so there's lots of options, but I think they really need to concentrate on what is their fundamental role. There are certain things that they're there to do that nobody else can do, nobody else is there to do, and will just not happen if they don't do. And their primary interest is really looking after the needs of the residents in their area. Are the people living in their area living their best lives? Are the services that are there supporting the residents with what that particular cohort of residents needs? Are all of the different services that come from other levels of government actually being used by their residents? So we look to, through Link, through my work at Link, we're really looking to partner with a lot of these councils to form a collaboration to say, how can we maximise your residents' uptake of the available services? A lot of the services don't come from them, they don't get paid out of council budgets, they get paid out of state and federal budgets, but there's a very different uptake. If you look at the numbers, and the numbers are hard to find and you've got to get into the research to see them, but you really see different uptake of services from different suburbs.
Interesting. It's one thing to have things built and provided, but whether or not people are actually engaging with them is a curious thing. But you're the managing director at Link Community and Transport, which is one of the more innovative providers of the sector, as I understand it. What are you seeing from your perspective there? Can you expand on that a bit further?
Yeah, absolutely. So it really fits in with some of the research. So there's some research from a different part of University of Technology, Sydney, on viability of aged care. And it actually says there's not enough money out there to do what people want. And that's no surprise.
Yeah.
And yet the current government is looking at putting more money into it, which is great and very welcome. It'll never be enough. We actually need to find how to do things differently. And Link's trying to not just have those discussions, but get out there and show how some of these things can be done, to take a lead and make things different on the ground as a way of saying there are other ways of doing it. The answers really lie in trying to bring care for individuals back into community, making more caring communities. And that's a really local level thing. Yeah. It's a really difficult thing for a federal government to do. Too big, too broad, too varied, too far away. It's very much that local thing. If aged care is seen as a service provision in the kind of way that medical is with hospitals and institutions, there will never be enough money, and it comes into kind of programs that people need to fit to.
Okay.
So it's all about trying to make people fit to programs. And that's been the history, that's how it's worked. It hasn't worked brilliantly for people, and what the evidence is showing now is that we can't afford to make it work for people. You have to turn it around and work on the individuals and what they need, and whether their neighbours, whether their family, whether the community that's around them, whether the local transport, whether the local cafe, all the local services that are in community are supporting them to live their best lives as they get older as they get more vulnerable, as they have more challenges to just walk down the street like you or I can. How can we support them to stay active, stay present, keep up that well-being, keep up their mental and physical health, keep them out of institutions, keep them out of healthcare. But the solution really needs to happen bottom up. So Link's doing a lot of things to just try and make these really practical programs at the grassroots. We're working with councils in some instances. In some instances, we're doing it ourselves. No secret, it works better when we're doing it with councils than when we're doing it with ourselves. So we're forming more partnerships there and trying to just show how this can be done. It's not kind of an idealistic, we need to make the perfect community. It's just the practical. We just need to make it work.
Listen to people, see what they want, find out, use your data and such. But Danny, if you had the opportunity, what would you advise councils and councillors to do during this period of change, and I suppose to come out at the other end with the best long-term results that we could expect moving forward? Now's your chance.
Beautiful. Thank you. So look, I think there's two parts to it. I think there's be adventurous and be positive about what can be created. But also, they fill a government role, and councillors have a role not dissimilar to a board. They can't do a lot of stuff at the ground level, but what they can do at a board can influence what happens at the detail level. I mean, there's a lot of discussion, some tongue in cheek, about what boards can and can't do. They meet for a couple of hours a month and are expected to guide an organisation, know all of its details.
Correct.
And they say, boards don't make any difference unless, of course, it's negative and they're holding things back, in which case which is unfair. But the question is, how can they actually find the governance practices that allow them to engage with that level of complexity and that level of change, and even that kind of visionary future thinking, how can we make things better? So there are forms of governance that are coming out in this space. It is one of my core areas of background. And it's to do with councils, and again, a role that is really kind of reserved for them because of who they are and where they fit, in stewardship at the local level. Now, the word stewardship means...
It's an interesting one.
It's an interesting word, and it's applied across all of government at different levels, and it's popular in some areas and unknown in others. But what it really means is saying, can we measure whether everybody has what they want? Whether they're happy, whether they're well, what are the things that matter? And can we as stewards say, well, what can we do? Where can we intervene to make things better where it is appropriate to make things better?
Well said by you, Dr. Danny Davis. Thank you so much for joining me in the studio to discuss what's going on in local government. I think it's an interesting one, and again, aspirational and optimistic. So thanks again for your time.
Pleasure to have the opportunity to unpack some of these interesting topics.